So I've been seeing videos of children on the autism spectrum displaying aggression, and people have been giving different opinion, about how the behavior should have been handled, how the behavior should have been addressed, and whatnot. So here's my take. Before a child with autism starts showing aggressive behavior, there are so many things that you should check as, the parent, the guardian, the teacher, or whatever. Some of these questions I'll be discussing in this video, so be sure to watch to the very end. Aggression is a communication from a nervous system that is most likely overwhelmed. And, I know a special need kid who is, very well behaved, but shows aggression whenever he's hungry. It took us a while to figure that out because he couldn't communicate initially. Not until he was trained to say or to show gestures when he needed food, water, or whatever, especially in places where he didn't have access, to, getting the food by himself or whatnot. So before a child starts showing behavior, aggressive behavior, make sure to ask yourself if, number one, they have a reliable way to communicate. Make sure your child can communicate, and this takes training. The way typical kids learn to use spoken language, a kid with special needs should also be trained to use a form of communication, especially if they are not verbal. It could be visual, it could be sign language, it could be AAC, gestures, or cards, whatever works. Number two question to ask yourself is, has anything changed in their routine? Routine changes hit people differently. Some people adapt very quickly, some people take time. So now imagine how hard a routine change can be for a child with special needs. So to avoid outbursts, it is very important to prepare them very well ahead of time for any routine change. Use visual supports. Give them transition cues like timers or maybe countdown to avoid outbursts. Number three, do they really get downtime? I mean real downtime. I know because they have special needs, parents put them in therapies, 6 to 8 hours at school, 2 to 3 hours of therapies and all that. This can be very, very overwhelming and can cause outbursts. So allow appropriate rest time, reduce overscheduling, and allow quiet and demand-free time. Next question to ask yourself is, are these outbursts a result of a physical or medical pain? Some pain shows up as behavior. For example, a child, going through, having constipation, reflux, allergies, or even fatigue. Some of them struggle to describe their body signals. So they just, outburst happens. So it is very important to check patterns. It is very important to be in contact with their medical providers and also to watch for signs of discomfort and also teach them body awareness. And the next question to ask yourself is, are we pushing them? Are you pushing them past their limits? Sometimes, your child refuses to put on their shoes for school and you keep saying, hey, hurry up, we gotta go, let's go, and all that. The child starts crying and drops on the floor. And, this looks like, defiance, but it is actually overload plus loss of control. So in this situation, you either, give them choices like, hey, would you like the blue shoes or the black shoes? Also give them, sequence language like, hey, we're going to do this first and then we'll do that next. This will help them, be in control, give them control. And, it's also make sure they're not pushing them past their limits. See, aggression can mean that a child feels unsafe, not that the child is being bad. And all this big behavior can also mean that, the place or the task is too much for their bodies. A child can hit because the room is too loud. A child can throw things because the work feels too hard. They can kick or hit because they feel, leaving a place feels too sudden for them. The child might scream in a store because there is too much movement and noise going on. In this case, do not use more force. Try to change the environment, try to lower the noise, try to make their task easier, give them breaks, warn them before transitions, and use pictures or visuals to explain to them. A calm body comes before a calm behavior. So if this has helped you see behavior differently, please subscribe to this channel, follow for more information, share this with a teacher, a parent, anyone around you, and drop a comment with one strategy you're going to try this week. Thank you for watching.